All right, let's just dive right into this explainer. Today, we're looking at the deeply fascinating and honestly super complex process of managing fatty liver disease, or steatosis. If you're looking to understand how the liver actually heals itself and what specific tools science has uncovered to help that process along, you are in exactly the right place. We're going to break down the actual mechanics of liver recovery step by step using the most heavily researched data available.
The big question we're tackling today is this. Can heavily researched dietary supplements and things called hepatoprotectors, which are basically just compounds built to protect your liver, can they actually reduce inflammation, regenerate your cells, and fix how your body handles fat? It's so easy to get lost in a sea of wild health claims out there, so we are going to focus strictly on what the scientific evidence tells us about how these substances interact with our liver biology.
Section 1. The heavy hitters. Let's look at the specific supplements that boast the absolute most solid scientific backing for liver health.
First up, we've got omega-3s, specifically the essential fatty acids known as EPA and DHA. You're probably getting these from fish oil or krill oil. Now, you already know they're great for your heart, right? But their impact on a fatty liver is incredibly specific and honestly, profound.
So, here's how they actually work. Omega-3s directly lower the sheer amount of fat or triglycerides stored right there in your liver. But they don't stop there. They act like a soothing agent, literally putting out the fire of inflammation while simultaneously making your cells way more responsive to insulin. It's basically a three-pronged defense system happening right inside your liver tissue.
Next up is milk thistle. It's an age-old remedy, but modern science shows us the magic is really driven by a highly active ingredient called silymarin. And hey, fun fact, did you know your liver is the only internal organ that can regenerate itself from as little as 25% of its original mass? Crazy, right? Well, silymarin acts like a literal shield for your hepatocytes. Those are your liver cells, protecting them from toxins and actively helping them regenerate. It's like handing your liver its own personal repair crew.
What's really fascinating here is that silymarin actually reduces your risk of fibrosis, which is that dangerous scarring of the liver tissue. But, and here is a major pro tip from the research, silymarin is notoriously hard for your body to absorb on its own. So you actually want to take it combined with phospholipids, like phosphatidylcholine. That specific pairing makes sure the protective compound actually gets delivered straight to the liver cells that need it.
Moving right along to Section 2, the antioxidant squad.
Okay, so when your liver's dealing with way too much fat, it generates this damaging oxidative stress. We're going to compare two highly effective ways to neutralize that exact threat. On one hand, we have vitamin E, a fat-soluble antioxidant heavily used for severe inflammatory cases like NASH. On the other hand, we have alpha-lipoic acid, or ALA. ALA is super unique because it's a universal antioxidant. It works in both water and fat environments, meaning it can reach virtually every single part of the cell.
Let's look a bit closer at how these two operate. Vitamin E is fantastic at fighting that oxidative stress. But, and this is a big but, it absolutely requires strict medical supervision for prolonged high doses because of some serious interaction risks with medications like blood thinners. ALA takes a totally different metabolic route. It works by safely improving your insulin resistance. Because it helps your body absorb glucose so efficiently, it basically signals your liver to just stop creating new fat altogether.
Now, I really want to introduce you to glutathione. Think of this guy as your body's master detoxifier. It's your most critical internal antioxidant. Your liver leans heavily on glutathione to process and flush out everyday toxins. But when your liver is fatty and inflamed, those glutathione reserves just get completely drained.
So, how do you get more of it? Well, you can't really just take glutathione directly because it doesn't absorb well at all. Instead, you use NAC. That's an amino acid that acts as a direct precursor. By taking NAC, you're basically handing your body the exact raw materials it needs to manufacture and boast glutathione levels right where it counts, inside the liver. It's a massive upgrade to your liver's ability to process toxins and totally crush lingering inflammation.
Section 3. Comparing the supplements. But before we wrap up our comparison, we are missing one critical link in this liver health puzzle. And that missing link is choline. It's usually grouped with the B vitamin family, and it is an absolutely essential nutrient. In fact, a direct deficiency in choline is a known primary cause of fatty liver. It is completely non-negotiable for your health.
So why is it non-negotiable? Well, because your body literally cannot create very low-density lipoproteins, or VLDLs, without it.
Think of VLDLs as the cargo ships your body uses to package up excess fat and physically haul it out of the liver. Without enough choline, those ships never get built, and all that fat, it just stays trapped right there inside your liver cells.
So, bringing this whole toolkit together, you can see that the details really matter. It's not just about taking any ALA, you want the RALA form for better bioavailability, or using the phytosome form of silymarin so you actually absorb it. And look at NAC. It's highlighted specifically because it lowers elevated ALT and AST, which are the main enzymes that flag liver damage on your standard blood tests.
Which brings us to Section 4, the Golden Rule.
Okay, here is the tough but absolutely necessary truth. Supplements simply do not work without lifestyle changes. None of these magic pills are going to save you if you don't fix the foundational root cause. You literally cannot out-supplement a diet and lifestyle that is actively damaging your liver every single day.
For maximum results, you've got to follow these 3 foundational steps. First up, strictly restrict your carbohydrates, especially fructose and refined sugars. Why? Well, your liver basically treats liquid fructose, like in sweet drinks and juices, the exact same way it treats alcohol. It converts those sugars directly into liver fat.
Step 2 is weight loss. But here's the really good news. You don't actually need to hit some perfect, ideal body weight to see massive internal changes. Dropping your total body mass by just 5 to 7% takes a huge amount of that heavy, fatty pressure right off your liver. It's a super achievable goal that yields dramatic clinical benefits.
And step 3, of course, is physical activity. When you make your muscles work, they get hungry for energy. That directly increases your overall sensitivity to insulin, which literally forces your body to stop storing fat and start burning that trapped liver fat to fuel your moving muscles.
Now, a quick but critical warning. Safety comes first, always. You absolutely must consult a specialist, like a gastroenterologist or a hepatologist, before starting any of the supplements we've covered today. You need the right dosages to avoid side effects, which is especially vital if you have existing chronic conditions or are taking any prescription meds.
So, as we wrap up this explainer, I want to leave you with one final thought. We've talked about powerful antioxidants and the sheer mechanics of fat transport, but you have to ask yourself, are you just relying on supplements to treat the symptoms? Or are you truly ready to change your lifestyle and treat the root cause? The science shows us we have the tools, but ultimately, the power to heal? It's entirely in your hands.